I'm delighted to be joined by a distinguished professor from Imperial College. We were just highlighting imperial modelling. He's been a very influential scientific advisor to the government on the kind of measures necessary to protect us from this terrible virus. Neil Ferguson, good to see you. If we could just sort of start with the possible course of the infection, as we unlock. You recently said that you thought it was possible that actually the Prime Minister's timetable for unlocking could be accelerated perhaps a bit if the data turned out better than currently expected. What do you think an acceleration could... I mean, the government is currently not really signed up to allowing a possibility for unlocking earlier, but what could an earlier unlock look like in your view?
Well, I have to say, I was interviewed and asked, is there any possibility of it? And I said, well, there's a faint chance if everything looks great, but I think my comments since then have been spun a little. I think it's unlikely. The key things the data we'll be tracking is how fast are deaths coming down, how fast are hospitalizations coming down, and how effective the vaccine is. I mean, the tests the Prime Minister set out, if we're in the circumstance the vaccines are even more effective than we currently estimate, and relaxing the first two stages doesn't lead to any significant surge in cases, then of course there may be some reconsideration around the margins of what's possible in May and June. But I actually think it's quite unlikely it will happen.
I mean, if we look at your modelling, as I understand it, you built into that modelling somewhat less efficacy of the vaccines than we've subsequently learned. Does that mean we can be a little bit more optimistic than those models showed, do you think?
I think the data is mixed at the moment. You're probably referring to the Scottish study, but they were quoting the very highest values they saw over a multi-week period. And what really digging into that analysis in Scotland, it's very similar to the values we've been assuming, namely about 80 to 85% protection against serious disease after one jab, basically. Slightly different between the different vaccines, but that sort of ballpark. And that's very comparable to the data from Public Health England, which suggests something like a 75 to 80% protection. So I don't think we're being overly pessimistic in how we're modelling the vaccine, but it is early days. We still are not yet seeing the impact we expect to see in the next few weeks on overall deaths and shifting the age distribution of deaths, because what we expect to see is the people protected, the age groups protected, become a much smaller portion of all the people being hospitalised and unfortunately all the people dying from COVID. That will be the much more conclusive data. And we should be in a position to really evaluate that, I would say, towards the middle of March.
Middle of March, OK, well, that's an encouraging day. And look, just actually looking at it from the other point of view, obviously a lot of our optimism is based on the vaccine. The government has committed to vaccinate all adults now by the end of July. Would that have actually been a rather better date for the government to fix on for removing all restrictions?
In the modelling we've done, it doesn't make an enormous amount of difference, but there are... So I should say we can't predict things exactly. We can't predict the effect of any one policy change. What we're doing is using data from last year with the tiers and other measures introduced and analysing it retrospectively to try and project forward. But there's a lot of uncertainty. That uncertainty grows as you look forward further in time. So I would say let's get through until May, June timeframe. We will also be getting additional vaccines coming on stream by that timeframe, which will potentially be even more effective. And the real thing we need to look and guard against is a resurgence of cases in the autumn. So I doubt there will be a really significant resurgence in the next few months. Maybe seasonality will help us, but the risk is into the autumn. And that's where we need to be thinking about ensuring we have the very highest coverage we can among any adult, regardless of age, and potentially topping up, as Chris Whitty and others have said, potentially topping up immunity with booster doses of vaccine.
Neil, please don't go away because we've got tons more we want to ask you. We're just going for a short break. Lots more from Neil Ferguson on the outlook as we lift lockdown. And we've also got Dr. Alex in just a couple of minutes. Welcome back. I'm delighted the distinguished scientist Neil Ferguson is still with me. Prime Minister was talking just the other day about how the time has come to, in a sense, just recognise that COVID is with us forever, and we've just got to, learn how to cope with it without massively restricting our lives in the way that we have been. And you've made the analogy that we've got to treat it a bit like flu. I suppose there are sort of two questions that spring to mind. One is, we just saw from Anushka that, in bad years, flu kills 20,000. Actually, before 2000, when people were vaccinated for flu on a regular basis, it was killing 40,000. Are we just going to have to, in a sense, come to terms with those levels of mortality for COVID-19? And there's sort of an associated point. It's very striking that wearing masks and social distancing means we've had almost no flu this year at all. So is there sort of a case for saying, actually, for years to come, it would just be a good idea to, whether it's imposed on us or voluntary, to wear masks and do social distancing?
It's an interesting question. I don't think just mask wearing will be sufficient to control flu. If you look across the world, then it's quite routine in, for instance, many Asian countries for people to wear masks if they have a respiratory disease. But they have just as much flu as the rest of the world. I mean, it's the social distancing which has really done this. And I think that's probably disproportionate. It's also not quite fair to compare what are called influenza deaths, but are actually pneumonia and influenza deaths with the COVID deaths this year. The excess deaths this year have been enormous compared with an average year. The hope is, though, clearly, once we get everybody up to a high level of vaccine coverage and keep that immunity up, probably through booster doses, I think we'll drive down COVID deaths to much, much lower levels than we've seen in the last year. And at that point, yes, maybe there might be cultural changes and people more likely to wear masks, but we'll principally manage it through vaccination.
But things like, I talked about it earlier, I don't know how many people think ordering from a table rather than going to a bar is a terrible thing. But if that kind of social distancing turned out to be quite a positive thing for our health, would it be such a disaster to continue doing that? No,
it'd be interesting. This year has changed our society quite fundamentally. It'll be interesting to see quite how quickly we bounce back in terms of our behaviours. It's not my area of expertise. You need to talk to a psychologist or behavioural scientist. But certainly my life has changed fundamentally. Everybody I know similarly, and it'd be interesting.
A couple of other sort of quickish ones. We just heard from Grant Shapps, the Transport Secretary, that he thinks when it comes to getting back to some kind of normal overseas travel, he thinks that it's the variants that are going to be more important than prevalence in a particular country. So he was basically saying you could have a country where there isn't so much infection, but there are a few variants we don't like, and we should be more cautious about travel to and from those countries. Do you agree with that analysis?
I certainly agree that we have to be very cautious of variants. My overall, I would say, quite optimistic tone, I would say, is caveated strongly by the potential impact variants might have. And we have to be cautious at the borders, but we also have to be cautious that the variant we're living with now, which is responsible for, in some ways, probably half the deaths we've experienced now in the pandemic in this country, and is the reason we've suffered quite so badly in the last few months, that arose in this country. And the virus is mutating all the time. So the faster we can drive down infections and then monitor to see if variants arise, either in travellers, but also within our own country, the better.
And just very briefly, because we're out of time, are you feeling optimistic or pessimistic?
I'm feeling a lot more optimistic than I did 3 months ago, but one always has to be cautious. And I completely agree with the Prime Minister. We have to be driven by the data, and there may yet be some bumps in the road to, I think, a much better summer.
Great. Well, it's lovely to talk to you. We're all hoping for a better summer and come back soon.